Hello, I'm Dr. Marla Shapiro. As a physician, I am sure you have heard this new term, genitourinary syndrome of menopause, GSM. What is it? Does it replace anything else? What's new that we need to know? And helping us with that very question is Dr. Jan Shifren. Welcome, Jan.
Hi, Marla.
Jan is the director of the Midlife Women's Health Center at the Massachusetts General Hospital in Boston. So for most physicians who take care of women, we're intimately familiar with VVA or vulvovaginal atrophy. Now we have three new letters, GSM. What does it mean?
Well, GSM, or genitourinary syndrome of menopause, incorporates VVA, so we're not completely doing away with the term. But what's important to realize is that VVA really just describes estrogen deficiency changes of the vulva and the vagina. But GSM really is a whole syndrome that involves symptoms of the vagina and the urinary tract and also sexual symptoms. And these symptoms need to be bothersome and not accounted for by anything else but estrogen deficiency for a woman to have a diagnosis of GSM.
So it's a much broader term.
Absolutely.
Than VVA. So I guess the important question to ask is painful sex always a result of VVA, or are there other things as a healthcare provider that you should be ruling out?
The most common reason for painful sex after menopause is definitely GSM. Up to 80% of women will have symptoms of GSM, and in those women, over 50% will have bothersome pain with intercourse. So it's really the #1 cause of discomfort with intercourse after menopause. But of course, it's important to think about other alternative diagnoses. There could be a lesion in the vagina that would need to be seen on exam and treated. There could be another anatomic or structural change, such as endometriosis or a pelvic mass. So of course, you do want to think about other alternative explanations.
So many of these women have tried over-the-counter lubricants, plus, minus moisturizers, and don't really get much better or are still symptomatic, and they end up in our office. Often we don't ask. Hopefully physicians will ask. So what's available for treatment that we can offer them once they've tried moisturizers, once they've tried lubricants, and it's just not, really helping all that much?
Well, pelvic PT is one other non-hormonal option that I do like women to think about. It can make a big difference. But if moisturizers, lubricants, and pelvic PT for those women who may need it is not effective, really low-dose vaginal estrogens are our most effective treatment.
So that's physiotherapy that you're talking about?
That's right.
And where can doctors really find helpers to help them with this really specialized area?
Yeah, really, you want to find a certified physical therapist who has a lot of expertise in the pelvic floor. And this is really becoming a much more common referral in my practice. Women with incontinence, women with pelvic pain, and women who've had, typically for my patients with GSM, it's often women, let's say, who've had a history of breast cancer. And they have not been active for a while during treatment, and now they're trying to reinitiate their sex lives. And we'll start with lubricants and moisturizers, but there are still so many changes in the pelvic floor that they're having a lot of discomfort. And that group of women will really benefit often from the combination of moisturizers, lubricants, and pelvic PT.
So let's go on now to local estrogen vaginal therapy. First, the local therapies that are available. A word about them.
There are 3 highly effective forms of low-dose vaginal estrogen. There's a tablet that's placed in the vagina twice weekly, creams that are placed in the vagina 2 or 3 times weekly, and a very simple to use vaginal ring that's put in the vagina, left in for 3 months, and again releases a very low dose of estrogen over the 3 months.
And for women with an intact uterus, is a progestogen ever indicated?
You do not need to use a progestin when you're using very low doses of vaginal estrogen. Essentially, the low-dose vaginal estrogen products will not bump a woman's blood level of estradiol, so there's no need for concurrent estrogen. Along those lines, though, I always say every postmenopausal woman should be reminded to report any bleeding after menopause, even if it's after sex.
Now, because it hardly bumps the level or doesn't bump it at all, what about women with breast cancer, those who are no longer on active treatment, and then those that are on aromatase inhibitors, for example?
Well, so let's say we have a patient who's not on an aromatase inhibitor. The majority of those women really can safely use low doses of vaginal estrogens, as you said, simply because the blood levels aren't bumping. I typically do speak with a woman's oncologist and make sure the oncologist is also on board with treatment. But many oncologists are, especially if women have tried other options and they're still really distressed by changes in their sex life.
And for those on aromatase inhibitors?
The tricky thing there is that the goal of aromatase inhibitors is to take the low levels of estrogen that are present in postmenopausal women and basically reduce them to almost unmeasurable. tolerable. And so, although low-dose vaginal estrogens don't bump estrogen blood levels above typical levels for menopausal women, there will be a small amount absorbed. And so for women on AIs, it's probably not a good idea.
And for older women, as often we will be seeing older women who were initiating therapy, hypertension, heart disease, can they be using this medication?
Absolutely. A history of a heart attack, stroke, or leg or lung clot is not a contraindication to low doses of vaginal estrogens. Blood levels don't bump, and they really should be very safe in those women as well.
I guess the important message is that we do have so many effective medications for genital urinary syndrome of menopause, yet so many women aren't on therapy, often because we just are not asking.
Essentially, every clinician needs to ask every postmenopausal patient at every well visit, every comprehensive visit, do you have any vaginal dryness, discomfort with sexual activity, any concerns about your sex life?
Thank you so much.
Thank you.